Did your doctor tell you that you needed an abdominal hysterectomy and you wondered what that was? Well, today I'm going to talk about the total abdominal hysterectomy. We'll go over why doctors do that and what are the alternatives of an open hysterectomy. That sounds good to you? Continue watching. Well, welcome back to my channel. My name is Dr. DuPont. I'm a board-certified gynecologic oncologist, and I'm passionate about teaching women how to live longer and healthier lives, and I believe all of that starts with great health. So if that sounds good to you, continue watching. And if you're new here to my channel and you haven't subscribed, please click the button below to continue to be notified about great content as it comes out every week. Well, today we're going to talk about the total abdominal hysterectomy. So I'm almost done with the surgery series I've been doing for the past couple of months, and my purpose for this series was to just go over the different gynecologic surgeries that are commonly done so that you have information when your doctor or if you have a friend that's having surgery that you know exactly what the surgery is and what it entails. Well, today I'm going to talk about the total abdominal hysterectomy. Now what that is when we remove the uterus through an open incision. So nowadays we try to do minimally invasive surgery, and that's usually surgery through small incisions or using the robot or a laparoscope. Well, I'm going to do a separate video on that particular type of hysterectomy, but today's hysterectomy is going to be on the open abdominal hysterectomy. Now when we do an open abdominal hysterectomy, we're going to do the same thing. We're going to remove the uterus and the cervix and or tubes and ovaries, so it'll depend on what your doctor decides to do. So when we say total abdominal hysterectomy, that really just includes removing the uterus. Now I have some patients that'll say, oh, I had a partial hysterectomy. Well, that's not really a doctor's term, partial hysterectomy. So when you're having surgery for, let's say, fibroids or big pelvic masses or large ovarian cysts, a lot of times if the mass is very big and we can't get it out safely through the vagina, or if we can't get it through small incisions, then we'll do what's called an open hysterectomy. Now the type of skin incision will be either an up and down, which is a vertical, or a fan and still or transverse incision. So people think of the kind of C-section incision as a transverse incision. And how we decide that is typically based on the size of the uterus or the mass we're removing, and also the patient's risk factors. So let's say you're somebody that had a lot of surgeries. I'm concerned you may have a lot of adhesions. We may do an up and down incision because that gives us the best visualization. If I have someone that has small fibroids that I think I can get out, but I still need to do an open surgery, then I may do a transverse or fan and still incision, especially if they're very thin, because the surgery is a lot easier. So it depends on your body type, it depends on what you're having done and the reason, and then if you've had any prior surgery, which way we do the incision. So when we're talking about a total abdominal hysterectomy, again, that's removing the uterus and cervix. Sometimes we'll say, every now and then we'll have patients that want to keep the cervix, or we'll do a supracervical hysterectomy because let's say you had a big mass or endometriosis or cancer between your uterus and the bladder, and sometimes we can't take the cervix out. So if we leave the cervix behind, it's called a supracervical. So that just means that we took the fundus of the uterus and didn't take the cervix. If your cervix is left behind, then you still need Pap test screening. And I'll have some patients that don't know if their cervix was removed, so sometimes when I'm doing an exam, I'll look in the vagina. If I don't see a cervix, then most likely they had it removed. If you're having a vaginal hysterectomy, then of course to get uterus out, you have to have the cervix has to come out because it's the base of the uterus. So again, total abdominal hysterectomy is removing the uterus and cervix. If they say supracervical hysterectomy, then that means your cervix was left behind. Now in terms of your tubes and ovaries, these may or may not be removed at the time of an open hysterectomy. Some of the reasons why we will keep the ovaries is say that you're very young and you're having surgery, let's say for cancer. For some cancers, we can actually leave the ovaries behind for women that are young because we know that that's where the hormones are. If a patient wants to have children later and they're having to have a hysterectomy for whatever reason, we can also leave the ovaries because that's where the eggs are, and that'll allow them to be able to get pregnant later. Now, if we have someone that's older and that's having a hysterectomy, I do give them the option of taking their tubes and ovaries, but again, it'll depend on the reason why you're having the hysterectomy. Is it because of a cancer condition? Certainly if it's an ovarian cancer, we want to take the tubes and ovaries as long as we're not doing fertility sparing surgery. A lot of times if we're doing surgery for benign reasons, let's say fibroids or endometriosis, we may want to just keep the ovaries if someone is young and then remove the tubes. We think now removing the tubes reduces your risk for ovarian cancer, so sometimes we'll keep the ovary and remove the tubes in someone that's having an open hysterectomy. Now that we've talked about what are the types of hysterectomy hysterectomy, and we've talked about some of the reasons why we do hysterectomy, I'm going to talk about some of the complications. So for an open hysterectomy or total abdominal hysterectomy, your hospital stay will be longer. Women can stay anywhere from 2 to 3 nights. It depends on, the reason, of course, of the hysterectomy depends on their age and their health status. Some of the other complications would be infection, higher blood loss, injury to anything around the uterus, such as the bowel, the bladder, or the ureter. And those are some of the very common complications. There's always complications with infection, whether it's a bladder infection, pneumonia, pelvic infection, abscess. Those are all things that can happen. They're not common, but they can happen after an open hysterectomy or total abdominal hysterectomy. As with any surgery, you can have risk of having anesthetic complications just due to the anesthesia that's used. It's not common, but it can happen. Those are some of the most common infections with the open hysterectomy. Another one that I didn't mention was wound infection. So definitely the up and down incision does cause a lot more risk for infection. So, that's one reason why we like the less invasive or the laparoscopic or robotic hysterectomy. But again, it may not be possible in certain situations. And also risk of hernia formation. So I tell my patients that a hernia is just a weakness in the wall. A lot of times if we're doing an up and down incision, women may have increased risk of getting a hernia in that incision. And usually they'll feel a little bulge. Some people will have pain, and that's because that area just didn't heal properly or didn't heal strong enough. Women that have, COPD, women that are smokers, they have a higher risk of hernia formation because that tissue may not heal as well as it did in the beginning. So a lot of times your doctors may give you an abdominal binder. They may say no heavy lifting for several weeks after the surgery to reduce the risk of hernia formation. But sometimes no matter what we do, it still happens. So as with any surgery, you can have complications. So just be in mind that every time we do surgery, there's risk and benefits. So most of the time, the risks don't outweigh the benefits, and so that's why we do surgery. But again, that's some of the risk factors for an open hysterectomy. Well, that's all I have for today. Thank you for watching to the very end. If you have any questions or comments, or if you've had an open hysterectomy, you want to put some of your experiences in the comments below, we'll be happy to read those. And if you have any questions for me, just let me know. And thank you for watching to the very end. And again, if you've not subscribed, please press that button below, and I'll see you next time. Thank you for watching. Bye-bye.